My colleagues and I, we discussed three articles which are based on core stabilization exercises for lumbar disc herniation. So I will be summarizing each of them. Lumbar disc herniation, it is a common health problem that mainly occurs in young adults, and it leads to degenerative lumbar spine disease in older adults. LDS most typically manifests as low back pain, radicular leg pain, and neural functional deficits, and it causes both physical and social functional impairment. This first study, this was done by Ramin and his colleagues in 2014, and they wanted to study the effect of 8-week core stabilization exercises on low back pain, abdominal and back muscle endurance in patients with chronic low back pain due to disc herniation. They selected 30 patients, 15 were men, 15 were women, and they randomized them into two groups, experimental group and control group. Both of the groups contained 15 participants. Patients who had more than 3 months of low back pain, posterior and lateral disc herniation at L4, L5 and L5, S1, they were included. Outcome measures, it was measured at the baseline and at the end of 8th week. It included assessment of pain through visual analog scale and abdominal and back muscle endurance by trunk flexion endurance test and modified Beering-Sorensen test. Core stabilization exercises were done for 8 weeks, 3 times a week and for an hour. It included stretching for 10 minutes, strengthening for 40 minutes, and cool down exercises for 5 minutes. So for each of the outcome measures, the p-value was 0.001, which means that there was a significant low back pain reduction, significant increase in the abdominal and back muscle endurance in the experimental group when compared to the control group. So to conclude, this article suggests that core stabilization exercises, it can be used as an intervention in patients with chronic low back pain caused due to disc herniation. For the second article, it was done by Dixon and his colleagues in 2015. They wanted to evaluate the effect of lumbar spine stabilization exercise and general exercise on pain intensity and functional capacity with the patients with lumbar disc herniation. So they selected 63 young male adults which aged 20 to 29 with the diagnosis of lumbar disc herniation, and they divided them into two groups. First was lumbar stabilization exercise group and the second was general exercise group. Patients in both the groups, they received a low power laser therapy during the first week of the onset of the LDH. Patients in the general exercise group, they underwent a general exercise program. It included stretching exercise of limb and spine and strengthening of abdominal flexor muscles and lumbar extensor muscles. Patients in the lumbar stabilization exercise group, they followed this program for 3 months, and it included progressive deep core muscle exercises which included activation of deep muscles by isometric contraction of the lumbar multifidus and transverse rectus abdominis while maintaining a neutral spine position. Both these protocols, they were conducted for 12 weeks and 3 times per week, which lasted for 45 minutes. All of the patients, they were subjected to pain intensity and functional capacity evaluations at 4 times at pre and post LPL therapy and at the end of 3 months and 1 year post exercise. Pain intensity of the lower back and legs was evaluated with the VAS scale, and the functional capacity was evaluated with Oswestry Disability Index. For the results, both the groups had p-value 0.001, and they showed a significant reduction in the visual analog scale and the Oswestry Disability Index scores at 3 months and 12 months post exercise compared to before the treatment. To conclude, both are considered as an effective interventions for the patients with lumbar disc herniation. Moreover, lumbar spine stabilization exercise is more effective than the general exercise. For the third article, it was published in the year 2021. It was done by Yassir and his colleagues, and they wanted to compare the effect of 2 programs of suspension and core stability exercise on some electromyography coordinates, pain, and range of motion of patients with disc herniation. 32 men with disc herniation participated in this study, which were randomly divided into 3 groups. suspension exercise group, core stability exercise group, and control group. Electrical activity of rectus abdominis, internal and external oblique and erector spinae muscles were measured by superficial EMG. Back pain was measured by McGill Pain Questionnaire and the range of motion by modified Scober test. These all outcome measures, they were measured one day before and immediately after the intervention period. The experimental groups performed an 8-week training program while the control group was only followed up. Results showed that the suspension group had significant improvement in the EMG and the pain compared to the core stability group. Their findings showed that although both exercises were effective in the patients with lumbar disc herniation, the effectiveness of the suspension exercise in increasing muscle activation and reducing pain were more pronounced than the core stability exercise. This article was different from the previous two articles, as those articles concluded that core stabilization exercise were superior to the general exercise or control group, but this article, it specifically pointed out that suspension exercises were more superior than the core stabilization exercises. So after reviewing all the three articles, we think that core stabilization exercises are an important part of the exercise regimen for the patients with lumbar disc herniation, but performing it along with suspension exercises would be more beneficial. Thank you.